Welcome back. This is our third segment in part one of a special two-part series with Time Magazine's Joe Klein. So we were talking about how can the system be moved to a much more rational model, and I don't mean to demean the current system, but clearly it doesn't make sense.
It doesn't make sense. Well, there are a couple of things that that you could do to make the fee-for-service system more rational, and that is one thing is malpractice reform, because a lot of these extra tests that the doctors are doing is in order to have a paper record so that in case they get sued. But in Obamacare, or the Affordable Care Act, as it's known by people, unknown by most people, there are these pilot programs that give groups of doctors incentives, financial incentives, to go on to salary as an experiment. And they're given lump sums of money, and all the money they save, they can keep. Now, there's potential for problems here too if you have unscrupulous doctors. But the way Geisinger does it, and the way Mayo does it, and a number of these, Kaiser Permanente in California, is that they're developing these models based on their computer records of patients over 15, 20 years now. And they come up with 9 procedures that you need to do to treat a diabetic. These things work. They come with heart surgery. They now give lifetime guarantees for certain forms of heart surgery because they know what works. And the most interesting part...
What do you mean by lifetime guarantee?
Well, if you get a valve job and it begins to fail, they'll give you a new one free.
Okay. If you die, it ends the lifetime guarantee.
Well, it does. But sooner or later, most of us do.
Yeah.
Almost
all.
The really interesting one was their chronic care for the elderly, where what they did was to add a layer of bureaucracy. They added a nurse who is a case manager, and she gets a bunch of older people, and she calls them on the phone 2 or 3 times a week and goes to visit them, and they get these Bluetooth scales where they go to weigh themselves every day, and it goes right into the Geisinger computers. And with my parents, they wanted to talk about their kidneys, they wanted to talk about everything, they wanted to talk about their bowel movements. The nurse, the care manager, does that. And so what they found, and keeps them on the up and up in terms of their medications and all the rest, and what they found is that hospital admissions were down 18%, hospital readmissions were down 36%,
wow,
and costs were down 7%, even though they had added a new layer of bureaucracy. And so I think that things like this, as we begin to see that you can give better care, using, by giving, in many cases, fewer procedures and fewer tests, I think that there's going to be a real public outcry, and also the humanity part of it. I mean, Geisinger doctors have to take a 1-week course that they call Patients 101, where they're taught to look the patient in the eye and the patient's family and to shake their hands and introduce them to, I'm Dr. Joe Klein. You'd be amazed how many doctors don't do that because they, of course, believe that they are high priests of their practice.
Well, and of course, a lot of times people really don't see any of that until they're in some type of emergency or very difficult situation. So it's not something that most people think about until they're in the middle of it.
But it also requires a new skill set for doctors. You got to be able to talk to patients and their families who often want to do more, and convince them and let them know why it's not right to do more.
Are there any medical schools doing that now?
I don't know. I don't know.
One of the interesting aspects is with the addition of 30 million people to the medical care arena, some projections are that there's going to be a tremendous demand, increase in demand for doctors that's going to be in part unmet. Does it make sense for, especially looking at the economic model, does it make sense for the federal government to get involved and say, we're going to have a 10-year program, or we're going to have a 20-year program where we are going to, for example, fund 20 institutions to each ramp up a medical school and train and graduate doctors, nurses, physicians, assistants, and generate something like, I mean, if each of them are just bringing out or graduating several hundred a year, if you have that many institutions, you could close that gap and increase the pool of those.
We're going to have to see. I mean, if we get to the point where we've reformed the fee-for-service system and doctors are doing fewer procedures, you might also have nurse practitioners doing more procedures. There are many things that nurse practitioners can do that doctors now do, and so we're about to go through a massive restructuring of healthcare in this country. It was going to happen with Obamacare, without Obamacare. It was going to happen. And we're going to learn a lot along the way. And it may well be that we're going to have to train more doctors. And it may well be that the federal government is going to, provide some of the resources for that.
Well, I would think, I mean, and I was just tossing out numbers, but I would think something like that if you were spending, 10 or 20 billion a year, which for healthcare is not a lot, and you're creating this pool of expertise, the pool of professionals that is going to last decades, that at the minimum, not only do you meet the demand for services, but you also, by bringing so many more people into the system, I think you'd have a supply and demand effect in terms of cost. Well, we'll talk more with Joe Klein. That's the end of part 1 of our 2-part series. Thanks for watching. We'll see you next time.